Migraines, they're more than just headaches. They're actually a window into the brain's complex systems and significant challenges for many healthcare providers. Imagine not just managing migraines, but mastering the art of clinical integration to treat them comprehensively. In this conversation, we're joined by Carrick Institute's Assistant Professor of Neurology, Dr. Adam Harcourt, and we're going to talk a little about the course that he prepared for us called Mastering Clinical Integration and Patient Care specific to migraines. So let's explore how we can elevate your patient care through achieving breakthrough results. Thank you so much, Dr. Harcourt, for putting this course together. I think we have a couple of questions that everybody watching this is kind of dying to know the answers to. I've kind of selected 5 things that I think will answer those questions. And my first question for you, are you ready for rapid fire questions?
Let's do it. Thanks for having me.
Yeah, of course. So the first question, why is it essential for healthcare providers to move beyond symptom management and focus on clinical integration when treating migraines?
It's a great question. And it really goes back to what we talk about in the Mastering Migraine program on day 1, basically. And it goes to the fact that most people look at migraine as headaches, for example, but headache is the result of the neurological dysfunction. And so people that have vestibular migraine, ocular migraine, hemiplegic migraine, they all have the same underlying pathophysiology. It just affects different parts of the brain. And so when you're looking at migraine, you might have somebody with a right-sided migraine, for example, and the next patient has the exact same presentation, but the area of the brain that causes that presentation is completely different. And when you look at that patient from kind of a zoomed out perspective, and instead of saying, where is the pain, what's going wrong, you say, wait, where is the area in the brain or brainstem that has been genetically mediated or genetically altered to cause these migraines? Now your treatments can be a lot more effective. So if you're a chiropractor, maybe that ends up being an adjustment, maybe not. Or if it is an adjustment, maybe it ends up being a little bit different than you would have done it before because it targets a different area of the brain. If you're in other fields like, say, acupuncture or medicine or surgery, that can actually alter the treatment that you might do or the referrals that you might make for those different types of modalities. So it's one of those things where there's so many things that can help, but if you don't look at it comprehensively, you're kind of throwing darts and just hoping that it's the right solution.
You know, that's a great point. You actually kind of alluded to the fact that migraines kind of come in all shapes and sizes. And they're not just headaches, right? You can have migraines without having headaches, can't you?
Absolutely. Yeah. A lot of people don't realize they're having migraines because there's no head pain. And again, the information about migraine is not as good as it should be. And so that's why I love, teaching the course and writing the books and things like that. Is I find it so fascinating that this information's all out there. It's just for some reason that's not how it's perceived. And so it's really exciting to me to bring this to people, especially to practitioners, because there is a lot of people that need it.
Absolutely. So if you are focused on fixing the headache component of migraines, you might actually miss a whole lot, right? Because
Absolutely.
I think we all know that if you have a migraine, you can take an ibuprofen and a Tylenol and the head pain might go away. But that doesn't necessarily mean the migraine was fixed, or you could even take a CGRP medication, but it doesn't necessarily mean that the migraine is fixed. Is that correct?
You could drink a bottle of vodka and maybe feel better, but that doesn't fix the migraine. And
until the next day.
And that's exactly right. And most of these tools that we have that might get rid of the pain, what I always try to emphasize is the fact that they're basically handling different aspects of migraine, but not what causes it itself, right? Wow. And so this is where we kind of look at it these different angles. And ultimately, you can think of it kind of like an allostatic load disorder. And so it's not that there's any one thing that causes it, but the way I always describe it is it's like you have a bucket in your brain, and when it fills up with all these different stressors and the bucket overflows, that's when you get a migraine. Or in the more clinical sense, it's what causes hyperexcitability. And so our goal is to limit that so that you don't end up having these symptoms, whether they're head pain, dizziness, hemiplegia, whatever it ends up being.
Absolutely. So this course that you put together is part of the series of Mastering Clinical Applications in Patient Care. So we're assuming that the people that attend this course have a pretty good understanding of migraines, the pathophysiology, and all of the things that you taught in your migraine program. And some people might be attending just without taking that program and wanting to learn a bit more about it. So the next question is, what key insights or tools will participants gain from this course that they can essentially take back to their practice and to their patients who matter the most and apply them immediately?
Yeah, great question. And that's where I'm really excited about this course, because I remember when I first started in the functional neurology space, I had taken courses for years and still felt kind of lost. And it wasn't until I did grand rounds with Dr. Carrick that a lot of things just started to click, because you see it over and over. You get to see the thought process and all this. And it made me a lot more confident to actually do this in my own practice. Whereas before, I just felt like, man, I have no idea what I'm doing. It sounds cool, but I don't know. And so this course is meant for both people that have taken Mastering Migraine, but also if you've taken any neuro courses and have a basic understanding of things like central integrated state and TND and things like that, this is a really great way to take those concepts and give you some grounding and some foundation so that now you're able to go back and say, all right, maybe I don't have this whole thing figured out, but I do have a pretty good idea of how to evaluate this patient, what things to look for, and what modalities are likely to be effective and how to use those modalities. So my goal is that by Monday, you can have a migraine patient walk in and feel like, okay, here's the things that I need to look at. If I see these things, here's how we're going to manage it. And most importantly, expectations for that patient, right? Because one really important thing about migraine is it's genetic, right? It's genetic, which means you're always prone to it. It just means that you don't always have to have the phenotypic expression, even though the genotype will always be there. So just kind of managing those expectations help people in the long term.
I think we've all been there before in professional education and even postgraduate education, where we're just consuming information over and over and over again. And it's almost like, when you eat a big meal, your stomach feels so full and like, am I actually going to be able to digest this stuff? A lot of times we feel like that when we're taking these neurology courses. So I think what I'm hearing you saying is that whether you have consumed a bunch of information in the migraine program or other places, it seems like this program is going to pull them all together, organize your thoughts so that it's easily implemented. Does that sound about right?
Absolutely. Yeah. That's why I'm super pumped.
Yeah, absolutely. I'm pumped as well, too. As you can tell, I get excited about these things. So I guess that leads to my next question. So how is this one course specifically going to simplify the diagnostic and treatment process for providers? It may just be what we just said by organizing things, or there might be some more there.
Yeah, no, that's a lot of it. But also the way that we taught the course was in kind of a sequential order. So we'll be referring to that kind of guideline in the course, because when I look at each patient, I'm not looking at it as a chiropractor, right? I'm looking at it even zoomed out. I'm looking at it as a doctor, as a diagnostician, because maybe what this person has, in my practice, I can't provide that. And for me, it's way more important that I know what's going on with this patient and I can get them to the right person. My main focus is that this type of course is leading the people that take it to be a primary care physician for migraine, right? It doesn't mean you fix everything. It just means you can set this person on the path to get them out of what they've been dealing with. Because a lot of patients that I've seen over the years, they've had it for 20, 30, 40 years with no solution. We work with them for a really short amount of time, and now they're back to their life. So what if that person would have had that direction 10, 20, 30, 40, 50 years ago, right? And that's what I'm really trying to get in place here, is that you feel confident enough, you have the framework to say, here's the things that we're looking at, check off the list, go down the line, and by the end of it, say, great, I can handle all of these things, but you need to go over there for this. Or, nope, we got everything here. You're going to be in great shape. If you get super stressed out, maybe you'll end up having a migraine, but at least you can live a normal life. And that's the goal.
And I almost think you led me straight into this next question, which the question that we have here is, what types of healthcare providers is this course designed for, and what sets it apart from other migraine education classes?
Yeah, so I've been very fortunate to work with a lot of amazing migraine doctors over the years. And for me, what I start the course as is saying, look, I don't care what your background is. The way that we properly approach migraine is zooming out and saying, what is migraine? Because if you understand what it is, now the applications start to make a lot more sense. So I find that because migraine is a functional neurological disorder, that's what it is. And the practitioners that can affect it best tend to be the ones that use manual therapy. So your physical therapist, your chiropractors, your acupuncturists, things like that. But I've also seen that people in traditional medicine, in surgery, I used to refer to a migraine surgeon actually for certain cases, they can all really benefit from this, because most practitioners, no matter what your background is, my frustration is that they treat migraine for what they do, not for what migraine is. Okay. So whatever your background is, it doesn't really matter, because if you can get back to the basics of what are we actually dealing with, then you're going to be able to provide the care that these people need. So, if you've had cases and you're just like, man, why doesn't this pan out? Or why am I seeing this? Or why did this person do great with this modality and they got worse? The next person got worse. That's what this course is for, is to really make sense of all this. Because if you can make sense of it, now when things don't go the way you expect, you have the next step. You don't just say, well, I tried my thing, good luck. And that's what I see happening to people. They say, I've been to 15 different doctors, 8 chiropractors, 9 medical doctors, every med. And you zoom out and you say, well, you just got to do this thing. And now they're better. And so that's really what we're getting at. So, it doesn't really matter what your background is. If you see migraine patients, this is a course for you.
Amazing. So I'm going to go a little off script here and throw a little change up at you because you seem to be hitting home runs with every question I ask you. This, I think, would be really interesting for somebody watching this. Let's pretend that I'm a patient calling up your office and I have got migraines. Do you think we could do maybe just like a minute or two of role playing? Because, and I guess this is where this is coming from. I know your perspective of migraine is different than others. Mm-hmm. Somebody might tell you they have a migraine, and in your head, you're thinking, do they have a vestibular issue? Do they have a food allergy? Do they have Lyme or mold? Or do they have something else like this? So maybe let's just role play just for a minute or two and say, hey, doc, I've got a migraine. What can you do to help me? What are some questions that I can answer for you to see if you can help me or not?
Yeah, that's great. And actually, this is a perfect question because I do these all day, every day. And I always say the same thing. The first thing I always start with is I say, okay, great. Tell me 2 things. How often are you having migraines? And where exactly is the pain located? All right. Because one thing that you see in the literature is that migraine gets lumped into so many different things that I can't tell you how many people that have been diagnosed with migraine for 10, 15, 20 years. 2 minutes on the phone, you go, that's post-traumatic headache. That's from concussion. That's not migraine at all. They go, wow, yeah, it's weird. None of the migraine meds work. It's like, because it's not migraine. Of course it didn't. And so those are the first things I ask. And then I go, well, let me just explain migraine. And so the way that I explain it is I say, look, migraine is a genetically mediated disorder, meaning that not your parents have to have it or anything, but your genes are different than people that don't get migraine. And what those genes do is they allow certain areas of the brain to basically fatigue or fail. And when they fatigue or fail, you get symptoms. So if you imagine that the part of your brain, because everybody's individual, the area that leads to migraine is like a little bucket. When that bucket fills up with hormonal stress, emotional stress, musculoskeletal stress, whatever it is, and the bucket overflows, that's when you get a migraine. And the interesting thing is the only way to fix that is either keep things from filling up the bucket, which is great. It's your classic model, right? Maybe it's musculoskeletal, so you get adjusted, or it's vestibular, you go to a functional neurologist, or it's dietary, so you try a diet. All those things can be really good. But what's unique and what we do differently in our treatment is we find you can also make the bucket bigger, okay? Because if you're getting 15, 20, 30 migraines a month, you got a tiny bucket. It's a thimble. It's not even a bucket. And so it doesn't matter. You might be doing chiropractic that is awesome for you, but there's so many other things filling up the bucket, it doesn't look like it made a change, right? So you go into the next thing. Might be great for you. Too many other things filling up the bucket. So what we do is we find if you can identify the area of the brain or brainstem that is involved with migraine, facilitate stimulation, whether it's therapies, exercises, treatments, whatever, that activate those areas of the brain, create more proteins, make that area what we call less hyperexcitable, or make the bucket bigger. Now, when the bucket's getting bigger and you're keeping things from filling it up, that's where you start to get a regression of your symptoms. And so if you're getting 20, 30 a month, that first regression feels amazing. They get 2, 3, 4 days. It's fantastic. But once you do that, now the things that used to flare you up, they actually can help you keep from getting your next migraine, which is amazing. So the long-term treatment ends up being your daily life, right? And a lot of people I see, they haven't had that for a long time because just walking outside, migraine, just getting up to move, migraine, right? But long-term, those are the things that can actually keep you from having a flare. So that's kind of how I explain the whole system of what we do.
I told you it was different. Perfect. So I think that pretty much answers it on the main questions that people have. So if you're a doctor and you see patients with migraines and you want to help them better, the Carrick Institute's got a course for you. Dr. Harcourt put together a Mastering Migraine program, and now we have Mastering Clinical Applications in Patient Care, the Migraine Specialty course. So if you're interested in this, visit carrickinstitute.com, or if you have any questions about the things that we talked about today, you can simply just either comment on social media or send us a message, and we're happy to get back to you as soon as we can. Thank you so much, Dr. Harcourt, for putting this together. Thank you, Carrick Institute, for hosting the course, and we hope to see you there.